It is Sue McKenna speaking from the Center for Postgraduate Studies. And we are very privileged this afternoon to have Dr. Liezille Jacobs from Psychology at Rhodes University to talk through some ideas around systematic reviews. Now, for those of you who are completely unfamiliar with systematic reviews, they are becoming more and more common, primarily in medicine, but increasingly I see them being used in all manner of disciplines. And they are far more than a literature review because they actually function as a methodology, as Liezille will explain to you. Center for Postgraduate Studies does offer a short course on systematic reviews. We've already offered the 2021 course, unfortunately, but we'll offer it again next semester at the beginning of 2022. We put together the course in quite a hurry in 2020 after a number of requests to the center by people who said, you know, we want to be able to complete our studies, but we can't actually go and do field work. So we need to have a rigorous desktop methodology. And so that was my very steep learning curve around all of this. I also just want to, before I hand over to Liezille, I just want to make you aware, you can see on the screen at the moment, that our library, I'm sure you all know those LibGuides that they offer. If you're not familiar with the LibGuides, I highly recommend them. There's a LibGuide for all your different disciplines and fields, but there are also a number of general LibGuides where our librarians have kind of pulled together a whole lot of material on particular topics. And they've got one on systematic reviews. I've just put the link in the chat bar. And as you can see from this picture, you know, you can move across the menu at the top and you'll see that there's a whole lot of materials and videos and resources. So if you think this is something you'd like to take further, then please do have a look at this LibGuide. And if you would like to do a short course on systematic reviews, then certainly look out for that. We'll be offering that again in the first semester of next year. But we are very lucky that we have amongst us a colleague who has been using systematic reviews in various ways. And Liezille has not only used it for her own research, but she's also taught it. And she's made some materials available that we've used in the short course that take what can seem quite a complex process, and she's made it really, I think, very accessible and usable. So I'm very grateful to you, Liezille, for agreeing to share your time this afternoon. And I'm going to hand over to you.
Thank you, Sue. It's my pleasure to be here, and welcome everybody. I also just want to introduce someone from the library who will be assisting me today, and her name is Linda Cartwright. She's the humanities librarian, and because I'm in psychology, I asked her to attend and also possibly share how the library, how you can use the library with your systematic reviews. But before we start, I would like to ask you, at what stage of your development in systematic reviews you are, or if it's just something that you're interested in. I just want to know, for example, are you in proposal stage, or are you in the writing up stage where you've already conducted it? You can just send me a message in the chat, because I would like to know who I'm actually talking to and how to basically, how much detail I should give and what I should concentrate on more, because it's quite, you know, a lot to put into an hour and a half. So if you can just maybe just drop a chat. Okay, I see Evelyn says she's interested, and someone else said they just started. Oh, haven't started. Busy with data screening, completed, completely new. Okay, interested. Quality appraisal. Okay. Okay, proposal stage. Okay, so it seems as if, okay, so I get the sense that people haven't really started, and someone did say they did an appraisal. Okay. Okay, so I'm going to take it like as if all of you are interested in systematic reviews or different kinds of systematic reviews, and that you are in proposal stage. So I don't have to really go into great depth with the other part, which is really once you have your protocol in place, that's basically like a roadmap for you to continue your systematic review. So I'm just going to start from the beginning. Sue, can you see my presentation?
Yes, thank you, we can.
There's no black, something blacking anything out.
No, it's looking good.
Okay, okay. So in this very brief lecture, I'm just going to talk about why we would conduct systematic reviews and how different it is to literature reviews. And I'm going to take you step by step through the proposal phase. Okay, so.
Sorry, I think you may not see my comment in the chat, but I've already completed my proposal. So is it possible?
Okay, great. So I'll include the rest of it. Thanks.
Right,
Thanks for
thank you.
letting me know. Okay. Okay, I'm just trying to get this out of my way so I can see what I'm doing. Okay, so I'll start off by just explaining the difference between a systematic review and a literature review, because sometimes when you apply for ethics, you have some colleagues that will say, oh, but this could just be a desktop review. You don't need to do a systematic review for this. And so just by definition, a systematic review is high level. It's sort of the gold standard. And I think if you are in the health sciences, you will understand what gold standard research is. Like clinical trials, for example, are gold standard. And when it comes to reviews, the systematic review is considered to be gold standard research. So it's sort of high level research that is focused on, identifying, selecting, and synthesizing qualitative or quantitative research relevant to a particular question, whereas a literature review looks at summarizing something on a particular topic. And the goals for systematic review and a literature review are also different. For systematic review, it's usually focused on a clinical question. And I say clinical in this sense because systematic reviews were really made popular by health sciences, and social sciences use it, but in social science, as in my experience, we basically use it as a qualitative approach rather than quantitative. So within this systematic review, I'm going to use an example of a qualitative systematic review, just to give you sort of grounding as to how to go about it. Okay, so the questions are also very clearly defined in terms of using a particular framework. And this mnemonic you're going to hear me use quite a number of times. It's called PICO. And it's a guide throughout your systematic review. So PICO stands for population, phenomenon of interest, context, and outcome. So outcome is only for quantitative studies, because in qualitative studies you don't look at outcomes, so it's more context driven, whereas a literature review just looks at a particular question that you want to answer, and you just can do a specific, like a Google search on that. So I won't go into more detail because I think you get the gist of what the differences are. It keeps being in my way. Okay, so before we actually start with I'm struggling with this. I'm sorry, just give me a minute. I'm having some technical difficulties here. Can you guys see the screen perfectly?
Yeah, I think so.
So there's no black spots or anything in it. Okay, because
No,
I'm
no,
struggling with the
That's
okay.
probably your Zoom bar is probably showing for you, but
Yes,
fine.
and it's sort of yeah, all over
Away.
the screen. So I'm struggling.
Okay. No, it's
But
good for
anyway,
us.
okay, thanks. Okay. So basically, before we start, we have to, and I'm talking specifically here to masters and PhD students. Before you start a systematic review, you have to register. That's how different systematic reviews are to normal desktop reviews. You have to register it, and there are a few databases that you can use. You can use the Cochrane database, PubMed, Prospero, which is what this video clip is illustrating here. And you can use the JBI, so the Johanna Briggs Institute Evidence Synthesis, to register your systematic review. And there are 4 reasons why that you need to register your review. So the first thing is that you have to check if your review hasn't already been done. And if it has been done, is it 3 years or older? And if it is older than 3 years, then you can actually go ahead and register your review. So systematic reviews are considered high quality research. And so you have to reflect the specific criteria of interest for your topic when you actually register your review. And it's a step-by-step basis where they will ask you specific questions about your topic. So it's fairly user-friendly, and you should be able to follow the registration form very easily. The only thing that you cannot register, and so if you're doing a master's or a PhD and a scoping review is part of your not the only, obviously it can't be the only part of your research, but that it is part of your methodology. A scoping review doesn't have to be registered with any of these databases, because scoping reviews are very different types of systematic reviews. They look at research that is much less, like let's say we're looking at smoking and the sales of cigarettes during March 2021, you will get very little research done on that because it's quite recent. So those are the kind of studies that wouldn't required to be registered. So honors students, because it's your honors research paper isn't published on the university's library database, it won't need to be registered as well. But because our master's and PhD theses are registered on the library database, it has to be registered before you actually start with your systematic review. Okay. So there are steps that we need to conduct, and these steps already shows you the difference between a systematic review and a desktop review. Okay, I have a question here, point of clarity. If the review is part of a chapter for my MSc, do I have to register it? If it is a systematic review, and there are more than 11 different types, like there's rapid appraisals, there's different kinds of reviews. If your systematic review is going to be published as part of your degree, you have to register it because it's going to be published. And also, journals don't accept any systematic reviews that have not been published on those databases that I've listed before. So thank you for that question. I hope it helps other people also. Okay, so these are the different steps that I try to simplify it because it can get quite hectic in terms of all the different processes, but these are the 8 steps that you really just need to go through once you've registered your topic. So the first step is to formulate a question. And so if you conduct any type of research, you know that your research question, your topic, your inclusion criteria, your exclusion criteria, and your method, all of those need to align. So that's why within a systematic review, formulating a review question is so important. And then the second step is to define your inclusion and exclusion criteria. The third step is to locate the studies through search engines. And this step 3 and 4 is really where the librarian becomes your best friend in terms of helping you to locate the studies through the search engines. And also then step 4 is where you and your supervisor would work very closely in narrowing down the actual studies that you are going to include. Step 5 is quite a lonely process where you start now assessing the quality of the studies, and then you extract the actual studies that are relevant. And then step 7 would be, in the example that I'm going to use, would be a systematic review, a thematic analysis of all the results that you've collected. And then step 8 would be basically presenting and interpreting the results. Okay. So just to summarize this, there are basically 5 steps that I can narrow this down to, just to give you more clarity. So step 1 is framing the questions for the review. Step 2 is to identify the relevant work that you want to look at. Step 3 is to assess the quality of the studies. Step 4 is to summarize the evidence, and step 5 is to interpret the findings. Okay, I just want to see if there's a question. In education, I have not come across requirements by journals for the study to be registered. Okay, yeah, so I think it differs from discipline to discipline, but I think the health journals that I've published in has required me to register my study, or if my study was registered. Okay, so step 1, formulating the question. How do we go about actually formulating the question? So, like I said earlier, we follow the mnemonic called the PIPCO framework. So for any of you who are in science that is listening to this presentation, most of the time, this is what your PIPCO framework would look like. This is how you would formulate your question. You would look at the patient or the population of interest. You would look at the intervention or whatever interest you are in. You would look at the comparison of the intervention, and you will look at the outcome. So this is mostly for quantitative research, but for qualitative research, it's a bit different. So the example I'm going to give you is of a master's thesis that I've supervised, and my student has gone on and graduated, and she was shy of 2 points to get a distinction, which we are very upset about. But nonetheless, this was her topic. And so I'm going to use this as an example to illustrate how we sort of navigate through the different steps. So population of interest and context. the PICO framework for qualitative systematic reviews goes as follows. So the research question, according to the Joanna Briggs Institute method, the population is the phenomenon of interest and the concept, the context. And so in this study, which was titled Mental Health Professionals, Gender Sensitivity and the Responsiveness to the Genderqueer Population in Substance Use Disorder Treatment, was basically the population was mental health workers. And so they would either be classified as mental health care providers, clinicians, psychologists, or social workers in the different articles. Phenomena of interest were the experiences of the genderqueers individuals' treatment of the mental health professionals, and the context is basically substance use disorder treatment centers. So the research question then, given the PIPCO framework, we basically based our question on the outcomes of the PIPCO framework, and the following question was formulated for this review. How sensitive and responsive are mental health professionals to the genderqueer population in the treatment of substance use disorders? So you can see at each level of the PIPCO mnemonic, it was captured within the question. So this makes it much easier for you to develop your question, because if you just answer, like who's the population, what's the phenomenon of interest, what's the context, and then if you write that down, it will help you to sort of then synthesize your question or put your question together. And so that's the first step. So the second step is the inclusion criteria. And the PIPCO framework, again, is so important because it helps us to stay on par with our question. Because remember, our question and our inclusion criteria and our title and our methodology should all align with each other. And so that's why it's so important to first start with step one, where you formulate your question using the PIPCO framework. So the inclusion criteria then would look at healthcare workers, such as clinicians, psychologists, social workers, and they would be the population that the systematic review will focus on. So we'll focus on studies that explore the training needs of mental health care professionals, and it will look at studies where the context focuses on substance use disorder treatments. So to make it easier, the population then is the mental health care workers and how they interact with genderqueer individuals in substance use disorder treatment. The phenomena of interest, what we are interested in is the training of the mental health care workers and their needs to deal with genderqueer populations within substance use disorder. And the context that we were looking at for all the articles that we were trying to include in the study was basically studies that were conducted within substance use disorder treatment centers and in the healthcare system. Okay, so just to summarize the inclusion and the exclusion criteria. Okay, so we have the study design, the publication years, the phenomena of interest, and the context. So what we are including in this study is only qualitative peer-reviewed research that was written in English. And we looked at the year 2005 to present. We looked at genderqueer and mental health care and genderqueer and substance use disorder treatment. Already there you can see we sort of already know what our key words would be that we would need to actually go into and use when we get to the next part, which is our data collection. Okay, just need to move this, I can read. Okay, so data collection is categorized into 3 subsections, namely the search strategy, data screening, and the Prisma chart. So remember, just to reiterate again, I am following the Joanna Briggs Institute's method for systematic reviews. There are different methods like the Cochrane method, but this is the one that I'm focusing on. And if you are familiar with the Cochrane method, you will realize that this isn't much different. You know, the methodology is actually very similar. So phase 1 would be the search strategy. So you need to identify initial keywords, which we already done because we looked at the inclusion and the exclusion criteria. We looked at the PIPCO framework, which already helped us to sort of identify what our initial keywords were. So we came up with genderqueer and mental health care, genderqueer and substance use, and then mental health care professionals and genderqueer. The databases we searched on were, you know, as follows: Medline, PsychInfo, all the, you know, normal type of databases that, you know, psychology students would look at, but also we thought to include Medline and Web of Science because, you know, it's an interdisciplinary topic. Okay, so I'm going to hand over to Linda. I'm gonna, how do I? Okay, I'm going to hand over to Linda so she can show you what she does once you come to the keyword search phase. Linda, can you perhaps just take over the screen?
Yes, hi, thanks. Trying to get to my, there we go. Can you see my screen?
Yes, I can.
Okay, great. Thank you very much, Liezille, and hi, everybody. And Liezille, I'm going to stick to my 5 minutes as you requested, so I won't go on for too long. First of all, just to start at the point that Sue started on earlier on our subject guides, and I hope you are all familiar with them. And I'm going to go to the one that Sue had on the screen, the systematic review guide, which we have set up to help you with this methodology. Really just to show you our contact details here. So if you are in science or pharmacy, you would go to my colleague Tandiwe Menze. If you're in commerce or law, you would go to Jill Otto, and the humanities and education students are welcome to come to me. And as Sue pointed out, we've set up lots of useful links and readings on this guide. So it's a good starting point for you. But now what I'm going to do is go to the psychology subject guide, because most of the work I've done so far helping students has actually been for the psychology honors students who have come to me. And I always get them to go to the psychology guide, first of all, and to go to the databases and e-resources tab. Now, each of our guides for all the subjects at Rhodes will have this database tab. And on it, we have listed the resources that we feel are useful for that particular subject. Because we subscribe to so many, we don't want to list all of them. So we have selected what we think are useful for that particular topic. And here I always point out to them this new resource. I'm not going to click on it because I don't want to take up too much time. The ProQuest Dissertations and Theses Global, really useful resource that includes over sort of 2.5 million theses from around the world. So please do be aware of that. I just wanted to since I've got the chance to point it out to you. But now, for instance, with the psychology students, we would suggest that you search certain databases, and Google Scholar, always obviously a good one, EBSCOhost. If your topic has a specifically Southern African focus, then Sabinet, which is Southern African resources. Don't forget about that. Scopus, very good multidisciplinary database, and Web of Science. Also, even though it sounds scientific, very good multidisciplinary database. Also for psychology, we would recommend possibly PubMed or Emerald. But what I'm going to do is just, so for instance, the students come and we help them, we suggest the databases that would be useful for their topic, and then we help them formulate a search string. So what I thought I'd do is I'll go to EBSCOhost and just put in a search string to show you how we use the Boolean operators and to kind of refine a search. So I'm going to EBSCOhost, and EBSCOhost is a platform which hosts various databases. So you select them. In this case, Academic Search Premier is a very good default. And then I'm going to say Psych Info and Psych Articles. So I've selected those three. I go to Continue. And with the databases, also always a good idea to select the advanced search option, which gives you more flexibility with your search. So here I'm going to put in a search string, and I'm going to use a nesting technique, which is the brackets. And it's a way of listing your synonyms so that it will extend your search by picking up all your synonyms. So I'm going to put teenage. I'm using the truncation. And this is a technique that you can see it's the asterisk, and it will pick up the words teenage, teenager, teenaged, etc. So you are extending your search and you're not limiting it by using that truncation. Then I'm putting in all, and I'm going to put in adolescent. And here I'm putting in that asterisk after the N, so it will pick up adolescent, adolescents, and adolescents with the CE as well. And then all, here I'm putting in young adults. And you'll see I've used the inverted commas here because young adults is a phrase, is a phrase, and I want to pick that up as a phrase. And I'm going to put in youth. Okay, so that's, and close the brackets. So that is my string of synonyms that I wanted to search for. And here you always can just change that to all text. And here I'm going to put in another string. And of course, you can make these strings as long as you like, as complicated as you like, or depending on your search topic, obviously. And here I'm putting in depression, or again, I'm using the inverted commas, depressive disorders. So obviously there are far more synonyms for depression. I'm not going to put them all in now because I don't want to take up too much time. And then my final thing is going to be South Africa, which I put in as a phrase. So I'm searching for articles on teenagers or adolescents, etc., and depression in South Africa. And now I'm going to refine it further by saying I only want scholarly or peer-reviewed journals. That will cut it down significantly. And here you select your date range. And so let me say I want the last 10 years. So I put that in. Okay, so it's going to search across EBSCOhost. And now what I usually tell them at this point, I mean, this is my understanding of systematic reviews. And I've obviously still got a huge amount to learn listening to Liezille now. But that you systematically review the literature across the databases that you are searching. So you would put the same search, strings, etc., into the other databases that you are searching. So I'm going to just search for that. And it will probably come up with a large number of results. Yeah, a huge number of results. And obviously you can refine further. You go down, and as you all know, the databases are similar. They have similar facilities for refining by date, refining by subject. You know, we could immediately just say we want to make it just the last 5 years and update it. You might decide rather, because there are too many articles coming up, you're going to limit your date range, and that's taken it down by a couple of thousand. Okay, so this is just to show you, using EBSCOhost as the example, how to do your searching. And this is what I understand our role as the library staff to be in helping you, is to help you with the databases, to construct your search strings, and to help you refine your search. Also to show you that there's, on almost all the databases, there is a facility to create an alert, and you do that to set up your search string so that the database will alert you whenever new material comes in on this particular topic. So here you would put in your email, you'd say you want to be notified once a week or once a month, etc., and you would save that alert, and you will then receive emails whenever new material comes in on your topic. Okay, so that is very, very briefly just what I understand our role to be. And as I say, so far I've had mainly honors students come to me from the psychology department, just with help in identifying which databases they should be using and how to set up their search strings. Okay, Liezille, I think that's more or less what I wanted to show them.
Thank you so much.
Sharing. Is that sufficient? Just to give a very brief overview.
Yeah, I just want to before you leave, I just want to open up this platform to anybody who has questions, because there were some questions coming through the chat. So if you have any questions right now before Linda leaves, can you perhaps just write them in the chat, or you can just, raise your hand, and then I can field some questions.
If they think of something afterwards, they're very welcome to email me as well.
Okay, Linda, can you just put your email in the chat room so that they can know how to get hold of you? So some of the questions were if people can make an appointment. They also wanted to know, let me just read the questions. Okay, so the 3,000, there's a question, do you have to go through all those results, the plus 3,000? So that is why it's so important to narrow your keyword search. Or also there was a question about dates. So somebody asked a question about what dates. I can't get to that question now, but there was a question about how do you discern between what dates you need to basically look for. And that's something that you would look at in your protocol. So when I say protocol, I mean your proposal. So in your proposal, you specify what date you actually use, what dates you are going to look at. So articles published in what year. So you could say from 2005, if you know this is something that's very under-researched and you maybe want to go a bit further back, you would, in our case, we did 2005. Or you can say, like, if you get plus 3,000 already initially before you even start your proposal, you go and you just go on Google Scholar or wherever, and you just type in and you see that there's maybe 60, 70,000 articles coming up, then maybe that's an indication that this is an over-researched topic, and you will get very, good information from it. And then maybe just narrow your date to narrow the actual articles, because, as I go through my presentation, let me just share my screen with you again. I'll show you. Okay, can you see the screen? Okay, so phase 2 in the data collection phases, so that would be phase 1, where you would go and meet up with your faculty librarian, and you basically would be asking for advice as to how you can actually go about creating your search strategy. And once you've started with your search strategy, and you've chosen the databases that you want to actually go and type in your keywords. So remember, like Linda said earlier, for each keyword, you type it in each database, and I'll show you why. So this is what my student did. She created a Word document where she had an overview of the search procedure, the key topics, and the terms. And so she created this document to help her, organize her search strategy in a way that will help her to actually collect her data. So the identification of keywords is on the left-hand side of the screen, and then you'll see the search engines that she used, and then she would type in how many records came up whenever she typed in that particular keyword. And so that's why I said earlier, you might get 3,000 plus words if you are using a very broad keyword search, and the librarian will help you, and your supervisor could help you to narrow down your keyword search. That's very important. Otherwise, this whole procedure of creating this Word document is going to be much more difficult for you, because it means that you're going to have to actually go through and screen all these, articles, and remove duplicates, and, make sure that it fits in with the eligibility criteria. And if you can include it, what are you including? How many are you including of the articles on each database, as you can see it laid out here. So I'll just give you a moment to take in this spreadsheet, because we'll be talking about it again later. And I'll just pause a bit in case you have some questions. Okay, I'm going to move on. Okay, so the second phase is now screening all of these articles that you've found on your search. And there are basically 3 different phases of screening it. And remember this, I'm not sucking this out of my thumb. This is all part of the Johanna Briggs Institute's method. I see someone's raised their hand. You can go ahead and ask your question, Eric John.
So yeah, I think my main question is just, so what do I do with books? So when I'm doing a systematic literature review search, do I include in my inclusion and exclusion criteria that I'm only looking at articles And if so, does that mean I exclude books completely, or do I include books as well?
So that is basically up to you. That's what you have to decide when you are developing your criteria. So if you are looking at books, there are certain databases, like I think Google Scholar has books on, and then you choose actually that you're just looking for books. So when you write up your proposal, when you come to the inclusion and the exclusion criteria, if I can just try and go back. So can you see the slide where when I am referring to the inclusion and exclusion? So you'll see in study design, we've looked at qualitative research and we looked at peer-reviewed articles. So we didn't specify here that we looked at books. So we excluded quantitative and mixed methods, and we also didn't look at non-peer-reviewed studies, because often books are peer-reviewed, but sometimes they're not peer-reviewed, and that's sort of a slippery slope between whether or not you know if they are. So we wanted to have qualitative research, but not qualitative in the paradigm, but sort of research that has been peer-reviewed, and we didn't want to include books because they might not have been peer-reviewed in a very rigorous way in which we would have wanted to include in our publication. Yeah. Does that answer your question?
Yes, that does answer that question. And then my second, hopefully last question, I doubt it, is when you have articles that might not be readily available. So for instance, you either have to pay for it. How do I go about indicating that in my inclusion and exclusion criteria? Am I even to indicate that? Like,
no, you don't have to. No, that's not, there's many times when I'm looking for something, or I'm searching for something and I can't find it. And the librarians that I work with has always been very helpful. They either requested via ILL, which I think is interlibrary loan, or they will tell you that the university doesn't subscribe to it, so they have to purchase it. Even the same with books. So in that case, you just ask the librarian for access to the article if you can't access it.
Okay, and if they can't access it and there's no way to get to it, do I just leave it out and move on?
Well, then you can't actually use it in your study because you can't see whether or not it meets your inclusion or exclusion criteria, but you will note it here.
Okay.
Can you see the screen?
Yes.
So the overview of the search process. So you will note it here where you would say that you found, let's go to the one that you found the most articles. So let's say we go to the clinician's attitude towards queer individuals in substance use disorder treatment. She looked at Google Scholar and the records identified there were 27. Additional records identified through other sources were 5. And so in this column, we basically put articles that either we couldn't access or they were books and we weren't really sure if they were peer-reviewed.
Okay, that's great.
And then we would, so that's why I said take a minute to take this in, and just look at the headings that she used, because this really helps to put the systematic review in a much more clearer, systematic way and it helps you when it comes to the end where you sort of analyze. Then this sheet really helps a lot.
Yes, thank you so much, Doctor.
Okay, does that answer your question?
It does, thank you.
Okay, I'm just going to look in the chat quickly because it seems as if there's questions. How important is it? Okay, maybe you weren't here when I was talking about it earlier. So For a scoping review, you don't have to. That's the only review that doesn't need registration, especially for publication, because I've actually published a scoping review, and I could ask Sue to maybe make that available to you, or you can just search for my name and you'll see the scoping review. It was published in Gender and Behavior, and it was accepted because scoping reviews are very they're very narrow, because they sort of, you know, under researched areas that doesn't have a lot of information. Okay, and then Janine says you can. Okay, I can't see Janine's question now. You can then say that you will exclude articles that are not available in full text. Yes, that's perfect. Yeah. Yes, I can provide the slides to you, but this recording will also be available, Irene, afterwards, so that you can have it as well. Okay, there's no other questions. I'm going to move on. Okay, so we're talking about data screening now. So the initial screening was to exclude studies that didn't meet our inclusion criteria. So these were studies that had the following characteristics. So studies conducted prior to 2005 was immediately excluded when we did our data screening. Studies that were conducted in countries that we didn't specify, those were not included. And then also studies that didn't make mention of mental health workers or healthcare providers were excluded. That's the initial screening. The second phase was where we actually started reading the abstracts of the articles that we decided met the criteria. And so the third phase was to then actually read the entire article to decide whether or not it speaks to our research question, and the Microsoft Word document that was created, which I showed you in the earlier slide, was then created in this screening phase. So in the third phase, these columns were created which indicated whether an article met all the inclusion criteria or either didn't. And there was also a column that allowed for reasons to be stated why. So if you just want me to go back again, I can show you these are the headings, and this is basically the logic of the whole screening process. Okay, so once we got all of that done, we basically then said, okay, now we have all the articles we are going to include. We did an Excel spreadsheet, and then we basically went according to author, title, reference, phenomena of interest, and context, which basically meant this was our data. So all our data that we collected, this is just a snapshot. Obviously, there was much more than this, but you know, it couldn't fit into this slide, but this is an example then of what our data looked like. So if you would have interviewed people, for example, you would have recordings and then you will have the transcripts. So this was our transcripts. So this is what we considered our data that we collected. And this was the result of, you know, all the screening and all the, you know, the different steps that we followed. This was the result. So after we then, we got our results, we then had to populate the Prisma flowchart. So the Prisma flowchart is really just a summary of everything that we collected. And so the Prisma flowchart has 4 different categories, which is basically also, again, part of the PIPCO framework, which helps us identify the records that we, that we searched. We say the number of records that we screened, the number of records that were eligible, and then finally the number of studies that we included in our synthesis. What's interesting is that I've read systematic reviews that follow the Cochrane method, but they use the Prisma flowchart, and the Prisma flowchart was actually designed by the Johanna Briggs Institute. So I find it interesting that people use this, but they use a different methodology. I think because it really summarizes your research in a very succinct way. So then after you populated the Prisma flowchart, you will now do data analysis. So data analysis is, this is the data and this is what we're going to analyze. And we use Braun and Clark's 6 steps to that thematic analysis to then analyze all of this. So here we just looked at the different titles she used in Vivo also to do the thematic analysis. And so she looked at the titles, she looked at the abstract, she looked at all the different contexts in which the research was placed, and then came up with these themes. So after analyzing all of those articles, the 3 themes that stood out were accessing healthcare. So this is a theme that speaks to why genderqueer people have barriers to accessing healthcare. And that would basically lead into our second theme, which is that the interactions with mental health care providers were barriers. And some of the barriers were that when they come to the facility, for example, they would have to fill out a form where they are asked what their gender is. And then they always just have 2 different types of genders that they can fill out, either female or male. So it was very much binary. And that was a stumbling block for people in who are queer, because they don't feel included, and they, then that's a structural barrier to them accessing healthcare. Also, the interactions with mental health care studies stated that mental health care providers don't really have, the kind of experience to assist people who are queer. And when I say assist, I mean, to look at the different needs that they have. So let's say someone presents as female, but, is actually a male and is transitioning. The mental health care provider finds it difficult to place that person in a group, because groups sometimes people would say, no, you can't be here, you're not a woman, you're just a man dressed like a woman, and we don't feel comfortable, because maybe some of them were abused by men and they don't feel comfortable for the person to be there. So those are the kind of articles we found. And then also substance use treatment centers were not really queer friendly, for lack of a better word, because they really catered for cisgendered individuals, where they had a male group and a female group, and someone who was queer was really just found it difficult to navigate through that system. Okay, so then if there's no other questions, I'm going to continue with the last part of your proposal or your study, and that is to basically have a checklist. And this checklist is filled out by you and your supervisor. So you'll see on top there's a reviewer, date, author, year, and record number. Okay, I'm just going to pause because I see there's a question. No, the thematic analysis isn't the only analysis for qualitative studies, but it's the analysis that we chose. So like I said before, I'm using my students' master's thesis that was completed as an example so that, you can follow it easier rather than me just giving you, something that you can't identify with. So there are narrative analysis, there's different types of content analysis, for example, that you can use. It just depends on what your outcomes are or what you're trying to achieve with your systematic review. So I hope I answered that question. Okay, so to come back to the checklist, this is just a checklist for you and your supervisor to go through. So you would look at, so this is before you would now submit to your examiner, because this will be part of your appendix. So before you submit this even to your editor that looks at your document before you submit it for final examination, you will submit it to an editor who would look at your document. You can actually insert this as well as an appendix to just show that you actually, that this was a rigorous process and that you were not the only person doing this, but there was a librarian involved. So for example, was the search strategy appropriate? There you can say yes, and then at the bottom, you can see there's a few lines that you can write. You can say, I'm referring to point 3, myself, my supervisor, and our faculty librarian assisted us with the search strategy, and therefore I think it's appropriate. So just those kind of things to help you to minimize any types of questions that examiners might have about your systematic review. No, you cannot use thematic analysis for quantitative studies. There are, different kinds of meta-analysis that you can use for quantitative studies, but unfortunately, that's not my area of expertise. So I can't advise you on that. But if you speak to your supervisor or whoever you are working with on the systematic review, they might be able to assist you. Okay. Okay, so just in summary, systematic reviews are very much process-driven. And so I'm now going to show you something else that will help you to maybe understand it a bit better. So this is just a quick, brief step guide to systematic reviews. I will take any questions if you have. Yes, I agree. I agree with Colleen in the chat. Is there any questions before I move on?
Yes, one question.
Hello.
If a lot of the quantitative data we're getting is not specifically for South Africa, but it's for international countries, is there a method for us to infer the results we get when looking at it through a South African context?
So you're saying that your topic is South African, but you're getting international research.
It's a topic that can be applied anywhere. It's to do with financial markets.
Okay, so in this case, for example, this is where your inclusion and exclusion criteria becomes important. And you can't do a systematic review for research that's very, let's say you want to apply it in a South African context, or you want to actually apply it in a global context, for example. Let me give you another example. One of my students are doing a systematic review on problematic internet use and substance use disorder amongst women. And what she's found is that there's a lot of literature internationally about it, and not a lot of cyber psychology research in South Africa. And we wanted to focus on South Africa. And then we decided, okay, systematic review is not going to do that. That's why I said there's about more than 11 types of systematic reviews. This systematic review that I am talking about now is really just like an umbrella for all the others. So like a scoping review is for something that is very novel and very under research. So it is expected that you will get, you know, few results for it. But you can't do a systematic review for something that's not, you know, that doesn't have a lot of research done on it. Because then a simple desktop review would be sufficient, for example. I don't know if that answers your question.
Yes, kind of. I think maybe the way I asked it was slightly problematic. And
Do
there is
you want to
data.
rephrase it?
Yes, there is data, but I guess the way in which the investing take place happens in different generations of algorithms in South Africa and somewhere else. So though there is information about what's happened, it's different in a way. So I was wondering how to compare those two things. But I think maybe if I just wait for more information to appear in the South African context, it would be better for me.
Okay, yeah, and you can just email me also if you want to, you know, ask me anything if you, because it doesn't seem as if you are close to getting to, what phase are you in your proposal or your research?
Literally just finished the proposal, so I'm still going through it and wanted to get more information before I'd done anything with it.
Okay, so your question is, if you don't find information, you're not looking at a specific country, you're just looking at a specific algorithm, you said.
I'm looking at a specific algorithm within different countries, well, a specific generation of algorithm, which is third generation algorithms. So there's a lot of information of third generation algorithms in, for example, Germany and Netherlands, but it's more second generation and first algorithms that I'm finding data on in South Africa.
Okay. Okay, so you do realize that you're speaking to a psychologist, social scientist. So my understanding of your topic is very limited, but what I can speak to is the methodology, because it stays the same. And so what I think I'm hearing you say is you have difficulty in narrowing down your inclusion and exclusion criteria. And if you're getting a lot of information and it's a bit too overwhelming for you, I think maybe narrow your dates and narrow the countries, and then maybe that will help you to get adequate information. Does that help?
All right, thank you. Yes, yeah.
Okay, good, great. Wow, sure. That was a bit hectic for me to answer.
Thank you. You did a good job.
I'm glad that was useful. Okay. Okay, I see an article here that Colleen has posted. Yeah, the difference between a scoping review and a systematic review. But remember, scoping and systematic reviews are very popular, but there are different kinds of reviews that you can look at that might be more suitable for your type of research that you're looking at. But what makes it useful is if you are looking at a particular topic that is novel, then you would look at a scoping review. And what I like about scoping reviews is that you don't have to register them. So you're able to publish them better. I'm just going to try and share my screen with you again. Okay, so the checklist that I showed you earlier was just for you and your supervisor. But the Prisma checklist is actually a 27-point checklist. So it has 27 items on the checklist that you have to go through. Again, this shows you how difficult it is to do it's not difficult, I think it's just a lot of work. I think people think doing systematic reviews is better. It's better during, the pandemic to do a systematic review, of course, but it's quite labor intensive and it can take up until 8 months to a year to actually do a systematic review. So if you're doing a PhD and you're using a systematic review to sort of inform your quantitative research project or whatever, it is quite labor intensive. So you'll see that there's different section topics that they have. I'm not going to go through all of this because I will send it to you or to Sue to show you. There are, I'm just, because of the last question, I'm going to focus on the methods here. So you'll see under the methods, there's quite a lot of checklist items. So to specify the inclusion and exclusion criteria is on top of the list, which means it is very important because otherwise you will find that you won't have much success with your review. To specify the databases. So if you are looking at the wrong databases, it will also influence the results that you get. And so, if you really, that's why I said, the librarian has to be your best friend, because that first couple of stages or the first couple of steps in your systematic review is basically the part that you need to work very closely with your supervisor and the librarian, and sometimes go back and forth. So if you met with a librarian and you didn't have much luck with databases or with your keyword searches, maybe go back to your supervisor and find out how you can change it a bit. So this is even if your proposal is, obviously when your proposal is done, when you do your proposal, you think that, everything's going to be okay because you have this protocol all mapped out, but it doesn't always work like that in reality when you actually start and do the systematic reviews. I just want to try and okay, can you see the JBI systematic review? Can someone just open their mic and tell me if they can see the Joanna Briggs Institute systematic reviews interpreted by me?
Yes.
Yes, we can.
Okay, great, thanks. Okay, so if you go on the Joanna Briggs Institute's website, you will see quite a huge amount of information. So what, I'm basically saying is that I was taught this JBI method by the people who designed it. They came to Rhodes University and they gave a couple of the lecturers this training. And so after the training, I just sort of reduced it to a manner in which I could understand what they were trying to say. Okay, so this manual that I'm showing you now is basically for the people who are close to sort of ending the ending of their systematic review and they're about to submit. So this is just a summary for those of you who are in proposal phase or who are just starting, also just to summarize it. So this is what I took. This is me copying and pasting from their website and putting it into a booklet that made sense for me, because there's just so much information on the website. So I looked at, when do you actually conduct a desktop review and when do you conduct a systematic review? And we went through that. There's a huge difference between the two. And if there's anything that I want you to take away from this workshop is that, there's a big difference. There's a big difference between just hopping on Google Scholar, typing a keyword search, and then writing up a review versus a systematic review that you're actually looking up on a precise question that you developed in a systematic way. And there were steps that you followed. We spoke about the 8 different steps that we follow when we conduct a systematic review. So what's not part of the 8 steps is the registration. And I left that out because registration is only for people who are doing their masters and PhDs, because this is going to be published. Or if you really don't want to, ethically, I would not, in an open forum like this, say don't register your systematic review. Like I remember earlier, there was someone who said that there was just one chapter of their MSc that they were focusing on the findings of the systematic review. If it's something like that, I wouldn't, cry about it if I didn't register it. But, ethically, for other people to know that the systematic review does exist and it's been done in the past 3 years, I think it's only fair, because a systematic review is something that you should be able to repeat if you do it the exact same way that the person did it before you, but obviously if you're doing it after 3 years that the study was conducted, you would get different results. And so I didn't include that in the different steps because I feel like that's just an ethical question, whether you're doing an honors and doing systematic review as part of your, your honors research paper, but doing the master's and the PhD, I think you should definitely register your review. And if you do go onto these sites, you will find people that did something similar, and that could also be helpful because then you could, look up their work as well. And so that's what I basically just spoke about was planning, how to plan the JBI systematic review by registering it. Okay, so we spoke about the Prisma statement. I showed it to you earlier. It's the 27-item checklist. And there you can get all the different kinds of reporting evidence that you would have in your systematic review or your meta-analysis. And the benefits of using it is that it demonstrates the quality of your review. And again, the Prisma statement you are going to put as an appendix to your systematic review. So that 27-item checklist that I showed you, you're going to put as an appendix to your thesis to show that you're actually demonstrating the quality of your review and the strengths that you have and how it permits replication of your review. So we spoke about the title, we spoke about the review question, the PICO statement, and how that assists you with now starting to conduct your actual review. So after the PIPCO statement, the PIPCO framework is conducted. You will look at your inclusion criteria. That is where you speak about your participants. So remember, participants here aren't real people. These are people that are, you know, based on articles that you reviewed. So you will say that you will review articles where there are ages between 18 and 75. The gender that you will look at is queer individuals, for example. And so this is the type of participants that you can list under that section. Phenomenon of interest, this is also where the PIPCO framework comes in. You would basically look at what is the actual topic that you have, and how that relates to the research question. Obviously, the context that you are looking in. So if you are conducting research on people living in the Eastern Cape, in rural areas, for example, that would be your context. You will also talk about the types of studies. Remember, there was a question earlier about the different types of studies that you have. Brenda is asking me if I will share the manual as well. Yes, I am sharing the manual, but remember this, I have a disclaimer on this manual that this is just me copying and pasting what I found relevant after the training, because it can be quite intensive and it can throw you off a bit. So let me just get back to my point, the types of studies. So earlier there was a question by Eric John, I think, who asked, what if I want to have books, or what if I don't find the article? This is where you would actually include the type of studies that you will have in your inclusion criteria. Okay. The search strategy, remember, when it comes to the search strategy, you need to actually already have identified keywords based on the PIPCO framework. You would have keywords that you and your supervisor have you know, sort of accepted to be part of your study, and that's what you take to the librarian. And so the librarian will assist you to either narrow down the keyword search or assist you to go on certain databases that they think, because remember, they are in your faculty, so they would be more familiar than me with what happens in business or in pharmacy or whatever. And so they will be able to tell you, no, this, you won't find this in this database, check that database. So that's where the you know, the librarian comes in very helpful. Okay, and then the assessment of the methodological quality, that also is discussed in your inclusion and exclusion criteria. We've spoken about this critical appraisal checklist for qualitative research, and this is basically where you and your supervisor will go through this and tick it off and basically attach it to your appendix. This extraction tool is basically what my student did with the Word document. So she included this extraction tool, but she also included the Word document that she based this on. Because if you look at this extraction tool, you can see that all the headings is what she used in her Word document. Okay, and then that's basically it. Just stop sharing. Are there any questions? I hope that this was helpful and that you understood all the different steps, and that I didn't you know, confuse you even further. But if you have any questions, please Linda Cartwright is still online. I see. Thank you, Linda. I hope I didn't confuse you any further also. But I would just like to ask someone to wake James up. I thought that that was a picture, just like a picture of him sleeping, but I actually see movement of breathing. So, oh my word, that's so funny. Okay, James, so people are going to see this recording and they're going to hear that I was making fun of you. Okay, huge relief. Thank you. Will the recording be shared? Yes, it will be shared. Is there anybody else that has any final questions or comments or concerns that I didn't answer? Okay, there's a question. Let me just check. For the search strategies, do we search the same? Yes, yes. For consistency, you have to use the same search strategy. Well, I think you're meaning the same keywords for each strategy. Yeah. So each database, you type in the same keyword for consistency. Like you saw that, that Word document that she had with her keywords on the left-hand side, and then she just typed in all the different numbers of articles that she got for each strategy. Okay. There isn't a limit on the amount of keywords, but Eric, John, the more keywords you have, the more information you are going to generate, which means more work, more things to read. Bontle, do you want to ask your question? I see you have your hand raised. Okay, where did she go now? I thought I saw there was a hand raised somewhere. Okay, you can ask your question, both there. Sani. Okay, if there's nobody else who has a question, I'm going to say goodbye. And I hope that this was informative for everybody. I really enjoy speaking about it because it's something that I really like to do, especially with my honors students. Okay, thank you, everybody. Bontle, you raised your hand, but you're not asking the question. There we go. Yeah.
I'm so sorry, the network keeps kicking me out.
Oh, okay. I'm listening.
Okay, I just wanted to ask, and first of all, I just wanted to say thank you for the presentation. But with me, I'm doing my honors, and
okay.
The research is basically on the impact of low status jobs on the job satisfaction and the well-being of employees. So now I'm kind of confused because the studies that I came across after the whole quality appraisal thing and everything is sort of like quantitative. But I had already proposed that I was going to use thematic analysis. And then I think for Colleen, she said there's a way in which I can use quantitative, use like sort of thematic analysis to analyze quantitative studies. So I'm sort of confused as to how I'm supposed to go about that.
Yeah, I'm not sure how to do that because like I said, I'm a qualitative researcher. If there's anybody here, I've never heard of quantitative research being analyzed qualitatively. Only in the sense where, I don't know if you saw that spreadsheet where we had a Word document with the number of articles. So that helps us to complete the Prisma flow chart. But you need to, so when you're doing a meta-analysis, you're actually doing a quantitative analysis, and you need to choose maybe descriptive statistics or inferential statistics to, can't even say statistics, that's how much of a qualitative researcher I am. So I know that there's at least descriptive and inferential statistics that you can use as you know, to analyze the data that you do get, because remember, with qualitative research, we're looking thematically at patterns across articles that have formed, you know. So if you are doing a quantitative study and you're looking at patterns and you're saying, listen, I just want to see if there's a pattern formulated here, then basically that's what you can do. But otherwise, if you specified in your proposal that you're doing a quantitative review, I think that you have to follow through with that. I hope that helps. I'm sorry if you saw.
Yeah, it's okay.
Yeah. So let me just recap quickly and see if I understand you correctly. Are you saying that you're doing a quantitative study, but you want to analyze it thematically? Why do you want to? Why is that?
I'm doing a qualitative study.
Yes.
But in my searches, the articles that I found, where I think I found like only one qualitative study from like the whole appraisal, the searching, the appraisal. I have like the final articles is like 12, and then only one is qualitative, and then the rest are quantitative.
That's a very good question, because you know what, now I understand what you mean. So that's a very good question, because it speaks to your inclusion and exclusion criteria. Maybe you need to revisit that then, because if you are only finding a few articles in what you said you are looking for, you need to then adjust what your inclusion and exclusion criteria is going to be. And that's why I say, before you actually commit to a systematic review, just do a simple Google Scholar search on your topic and see what comes up. If there's a lot of research that comes up on it, then you are all set to do a systematic review. But if there's a little, then you should consider doing a scoping. And you said you're an honors student, eh?
Yes.
In which department?
Psychology, organizational psychology.
Oh, okay. Yeah. Now, so then basically what you have to do is just look at maybe just changing your inclusion, exclusion criteria to, or even, so are you doing a systematic review or scoping review?
I think it is scoping review, because I
then that's fine. That's fine, but
framework, you know, the PICO, I use the pieces.
Yes, yes. So it's not only the inclusion and exclusion criteria, it's also the databases. So maybe try and go and speak to your librarian, which is Linda Cartwright, which falls under our faculty. Maybe Linda can also maybe respond to your question, because I think maybe you should broaden the scope of the databases that you are searching for. Because if you're only getting one article on your topic, maybe you should look at different databases. Have you tried that? Hello? Okay, she disappeared. Linda, can you perhaps come in and just say, do you think that could be the case, that she should expand her database search?
I think she must email me her topic, so that I can maybe do a bit of looking around first, and see what I think would work for her. That would be helpful if she could send me her topic and let me just have a look first before she comes in, or before she contacts me. She can't come in anymore.
Yeah.
Yeah.
Okay.
I think that could be the problem. Yeah.
Yes, I think the databases you might be just limiting your databases. Okay, so thank you, Linda. Thank you, everybody, for attending. If there's no other questions, I'm going to say goodbye, but please feel free to email me or Linda if you have any further questions. Okay, bye.
All right,